Question 1. A patient is bitten by a dog in their own yard. What information is crucial for selecting the correct external cause code in ICD-10-CM? A. The breed of the dog. B. The specific location, own yard. C. The time of day the bite occurred. D. The patient's age. Answer: B. The specific location, own yard. This question emphasizes the importance of specificity in external cause coding, particularly regarding the place of occurrence. While knowing it was a dog bite is key to finding the initial code, external cause codes often require additional details like the activity the patient was engaged in and the place where the event occurred. The phrase "in their own yard" provides the specific place of occurrence needed to select a more precise external cause code from the relevant category. Always look for details about the activity and place for external cause codes. Question 2. Which anatomical term means towards the head or upper part of a structure? A. Inferior. B. Posterior. C. Medial. D. Superior. Answer: D. Superior. This question tests basic anatomical directional terms. The phrase "towards the head or upper part" is the definition of a specific directional term used in anatomy. Superior means situated towards the head or upper part of the body, like the heart is superior to the diaphragm. Inferior means towards the feet, posterior means towards the back, and medial means towards the midline of the body. Mastering these simple terms is essential for understanding documentation location descriptions. Question 3. Which section of the CPT manual contains codes for anesthesia services? A. Evaluation and management. B. Surgery. C. Radiology. D. Anesthesia. Answer: D. Anesthesia. This question tests your knowledge of the organization of the CPT manual. The CPT manual is divided into major sections based on the type of service. Codes for services related to anesthesia, including general, regional, and monitored anesthesia care, are found specifically in the anesthesia section. Knowing where to find codes for different types of services is fundamental to efficient coding. Question 4. A patient has chronic systolic heart failure with acute exacerbation. How would this be sequenced in ICD-10-CM? A. Code for acute exacerbation first, then chronic heart failure. B. Code for chronic heart failure first, then acute exacerbation. C. Code only for acute exacerbation. D. Code only for chronic heart failure. Answer: B. Code for chronic heart failure first, then acute exacerbation. This question covers the ICD-10-CM guideline for coding chronic conditions with acute exacerbations. The keyword is chronic, with acute exacerbation, which triggers a specific sequencing rule. According to the guidelines, when both acute and chronic forms of the same condition exist, the code for the chronic condition is sequenced first, followed by the code for the acute exacerbation. You would look up failure, heart, chronic first, and then the code description will typically include instruction or a different code to also capture the with acute exacerbation. Always prioritize the chronic condition code when it is linked to an acute exacerbation. Question 5. How is the CPT coding for therapeutic injections and infusions typically based? A. By the drug administered. B. By the physician's time spent. C. By the method of administration and duration. D. By the patient's diagnosis. Answer: C. By the method of administration and duration. This question is about the key factors determining codes in the CPT injection and infusion section. While the drug and diagnosis are documented, CPT coding for these services is primarily driven by how the substance is administered, e.g., intravenous infusion, intramuscular injection, and the duration of the infusion. The codes are structured around initial, sequential, and concurrent infusions, as well as injections, often specified by time increments. Focus on the administration method and time when selecting these codes. Question 6. A patient receives a durable medical equipment item. Which code set would typically be used to report this to Medicare? A. ICD-10-CM. B. CPT. C. HCPCS Level 2. D. Revenue codes. Answer: C. HCPCS Level 2. This question is about identifying the correct code set for supplies, equipment, and certain services not found in CPT. The keyword durable medical equipment points directly to the scope of HCPCS Level 2 codes. While ICD-10-CM codes diagnoses and CPT codes procedures/services performed by physicians/providers, HCPCS Level 2 codes are primarily used to report supplies, equipment, like wheelchairs, walkers, and drugs not included in the CPT injection codes, especially for Medicare and other payers. Remember that HCPCS Level 2 fills the gaps for items and services not covered by CPT. Question 7. What does the suffix itis mean? A. Surgical removal. B. Inflammation. C. Hardening. D. Tumor. Answer: B. Inflammation. This question tests your understanding of a very common medical suffix. The suffix itis consistently means inflammation. For example, appendicitis is inflammation of the appendix, and arthritis is inflammation of a joint. Recognizing this suffix immediately tells you that the condition involves inflammation. Question 8. A surgeon performs an excision of a lesion, 17,000, and a repair of a laceration, 12031, during the same operative session. How should the second procedure typically be reported? A. Report with modifier -51 appended. B. Report with modifier -59 appended. C. Report without a modifier. D. Do not report the second procedure. Answer: A. Report with modifier -51 appended. The concept here is coding for multiple surgical procedures performed during the same encounter by the same physician. The key phrase "same operative session" when two distinct procedures, excision and repair, are performed by the same surgeon suggests the need for a modifier. Modifier -51, multiple procedures, is commonly appended to the secondary procedures performed at the same session as a primary procedure, often the highest valued procedure. Modifier -59 is used for distinct procedural services, but -51 is specifically for multiple procedures by the same surgeon during the same encounter. Always check payer-specific rules, but -51 is the standard CPT modifier for multiple procedures. Question 9. What does the global surgical package typically include? A. Only the surgical procedure itself. B. Preoperative visits, the surgery, and postoperative care for a specific period. C. Only follow-up office visits after surgery. D. Anesthesia services. Answer: B. Preoperative visits, the surgery, and postoperative care for a specific period. This question is about understanding the scope of the global surgical package in CPT coding. The global period refers to a time frame that includes services normally provided by the surgeon before, during, and after the surgery. It typically bundles the preoperative visits, the intraoperative service, the surgery itself, and routine postoperative care for a defined period, e.g., 0, 10, or 90 days. Anesthesia is a separate service not included in the surgeon's global package. Know that the global package encompasses more than just the surgery itself. Question 10. A physician documents a history of present illness, HPI, that includes location, quality, severity, duration, context, modifying factors, and associated signs and symptoms. How many elements of the HPI are documented? A. 5. B. 6. C. 7. D. 8. Answer: C. 7. This question tests your knowledge of the specific elements required for HPI documentation in E/M coding. The question lists 7 distinct elements: location, quality, severity, duration, context, modifying factors, and associated signs and symptoms. To meet criteria for an extended HPI, you need 4 or more elements, while a brief HPI requires 1 to 3. Counting these specifically listed items gives you the number needed. Simply counting the distinct items listed in the question is the key to arriving at the correct answer. Make sure you memorize these specific elements as they are fundamental to E/M leveling. Question 11. A patient presents with chest pain, and after workup, no definitive diagnosis is made. How should the chest pain be coded in ICD-10-CM? A. Code an unspecified cardiac condition. B. Code the chest pain as a symptom. C. Do not code anything as there is no diagnosis. D. Code rule out myocardial infarction. Answer: B. Code the chest pain as a symptom. This question highlights the ICD-10-CM guideline for coding signs and symptoms when a definitive diagnosis has not been established. The key phrases are presents with chest pain and no definitive diagnosis is made. When the physician documents a symptom but cannot provide a specific diagnosis after evaluation, you should code the symptom itself. Coding rule-out diagnoses is not permitted in ICD-10-CM, and coding an unspecified condition wouldn't be supported without further documentation. Always code the highest degree of certainty documented by the physician. Question 12. What does the medical term hepatomegaly mean? A. Inflammation of the liver. B. Hardening of the liver. C. Enlargement of the liver. D. Liver cancer. Answer: C. Enlargement of the liver. This question tests your understanding of common medical prefixes, roots, and suffixes. Breaking down the term hepatomegaly helps find the meaning. Hepato refers to the liver, and megaly means enlargement. Putting these together gives you enlargement of the liver. Understanding these word parts is a powerful tool for deciphering medical terms on the exam. Question 13. What is the primary purpose of evaluation and management, E/M, codes in CPT? A. To report surgical procedures. B. To report office visits, hospital visits, and consultations. C. To report radiology services. D. To report laboratory tests. Answer: B. To report office visits, hospital visits, and consultations. This question asks about the fundamental purpose of the E/M section of the CPT manual. E/M codes, found in the 99XXX series, are specifically designed to report the services provided by physicians and other qualified healthcare professionals when they evaluate a patient's condition and manage their care. This includes common encounters like office visits, hospital rounds, emergency department visits, and consultations. These codes quantify the cognitive work involved in patient care, unlike surgical, radiology, or lab codes which report specific procedures or tests. E/M codes are used for almost every patient encounter where the provider is assessing and managing the patient's health. Question 14. Which section of the CPT manual contains codes for imaging services like X-rays and MRIs? A. Surgery. B. Pathology and laboratory. C. Medicine. D. Radiology. Answer: D. Radiology. This question tests your knowledge of the CPT manual's organizational structure. Services involving imaging techniques such as X-rays, MRIs, CT scans, and ultrasounds are specifically found in the radiology section of the CPT manual. Each section is dedicated to codes for services within that medical specialty or type. Becoming familiar with where each type of service is located in CPT will save you time during the exam. Question 15. A patient fractures their left ankle in a fall down stairs at home. What external cause code category would apply in ICD-10-CM? A. Transport accidents. B. Falls. C. Striking against or being struck by objects. D. Exposure to animate mechanical forces. Answer: B. Falls. This question requires you to identify the correct category for an external cause of injury. The crucial phrase is fall down stairs, which clearly indicates the mechanism of injury. External cause codes describe how the injury occurred, the intent, the place, and the activity. Looking at the options, a fall down stairs fits squarely into the falls category in the ICD-10-CM External Causes Index. Always identify the specific event that caused the injury to find the correct external cause code category. Question 16. A drug is administered to the left foot. Which HCPCS Level 2 modifier indicates the left foot? A. LT. B. RT. C. LC. D. TA. Answer: A. LT. This question focuses on using anatomical modifiers in HCPCS Level 2. The phrase administered to the left foot requires a modifier indicating the specific side of the body. Modifier LT is the HCPCS Level 2 modifier used to indicate the left side. Modifier RT indicates the right side. HCPCS anatomical modifiers specify the body part or location where a service or item was provided. Always use the appropriate anatomical modifier when a procedure or service is site-specific. Question 17. Which organ system includes the kidneys, ureters, bladder, and urethra? A. Reproductive system. B. Digestive system. C. Urinary system. D. Endocrine system. Answer: C. Urinary system. This question tests basic knowledge of human anatomy and organ systems. The list provided, kidneys, ureters, bladder, and urethra, are all components involved in the production, transport, storage, and elimination of urine. These organs collectively form the urinary system. Recognizing the primary function and main organs of each system is crucial for coding procedures and understanding diagnoses. Question 18. A patient suffered a stroke 6 months ago and now has residual weakness on their right side. How is the residual weakness coded in ICD-10-CM? A. Code the current stroke. B. Code the residual weakness first, then the history of stroke. C. Code only the history of stroke. D. Do not code the weakness as it is a symptom. Answer: B. Code the residual weakness first, then the history of stroke. This question deals with coding sequelae, also known as late effects, in ICD-10-CM. The keywords "suffered a stroke 6 months ago" and "now has residual weakness" indicate that the weakness is a lasting condition resulting from a previous illness, the stroke. When coding a sequela, the guideline is to code the condition or nature of the sequela, the residual weakness, first, followed by the code for the original cause of the sequela, the history of stroke. You would use a code for hemiplegia or hemiparesis and then a code indicating a history of stroke. Question 19. What does ABN stand for in medical billing? A. Advanced Beneficiary Notice. B. Approved Billing Number. C. Account Balance Notification. D. American Board of Neurology. Answer A. Advanced Beneficiary Notice. This question tests your familiarity with common terms used in medical billing and compliance. ABN stands for Advanced Beneficiary Notice, a form used by Medicare providers to inform beneficiaries that Medicare may not pay for a specific service or item. The purpose is to let the patient know they may be financially responsible before the service is rendered. Understanding what an ABN is important for proper billing practices, especially with Medicare patients. Question 20. An OP report states excision of malignant melanoma of the back, 1.5 centimeters diameter. What is the first step in coding this diagnosis in ICD-10-CM? A. Go directly to the neoplasm table. B. Look up excision in the alphabetic index. C. Look up melanoma in the alphabetic index. D. Look up back in the alphabetic index. Answer C. Look up melanoma in the alphabetic index. This question tests the crucial first step in coding an ICD-10-CM diagnosis from documentation like an operative report. The primary diagnosis documented is malignant melanoma. The first step is always to locate the main term in the ICD-10-CM alphabetic index, which is typically the disease, condition, or injury. While the neoplasm table is used for neoplasm coding, you must first find the entry for melanoma in the main alphabetic index. This entry will then direct you to the correct row and column in the neoplasm table and provide the initial code. Start with the most specific disease in the index. Question 21. A patient is diagnosed with metastatic carcinoma to the bone from a primary site in the lung. How would this be sequenced in ICD-10-CM? A. Code the primary site, lung, first, then the secondary site, bone. B. Code the secondary site, bone, first, then the primary site, lung. C. Code only the primary site, lung. D. Code only the secondary site, bone. Answer B. Code the secondary site, bone, first, then the primary site, lung. This question tests the specific ICD-10-CM guideline for coding metastatic cancer when the secondary site is the focus of treatment. The keywords are metastatic carcinoma to the bone from a primary site in the lung. When a patient presents for treatment of a metastatic site, the code for the metastatic site is sequenced first, followed by the code for the primary malignancy. If the treatment was directed at the primary site, the sequencing would be reversed. Pay close attention to the documentation indicating which site is being treated or is the reason for the encounter. Question 22. A surgeon performs an identical procedure on both knees during the same operative session. What modifier is typically appended to the CPT code for the second knee? A. -50. B. -51. C. -59. D. RT. Answer A. -50. This question is about using the correct CPT modifier for bilateral procedures. The key phrase identical procedure on both knees indicates a bilateral service. Modifier -50, bilateral procedure, is specifically used to report procedures performed on both sides of the body during the same operative session. Modifier -51 is for multiple different procedures, -59 is for distinct services, and RT indicates the right side only. For bilateral procedures, use modifier -50 on a single line item with the code if the payer allows, or append it to the second instance of the code. Question 23. A patient with type 2 diabetes has diabetic nephropathy. How is this typically coded in ICD-10-CM? A. Code for diabetic nephropathy first, then type 2 diabetes. B. Code for type 2 diabetes first, then diabetic nephropathy. C. Code only for type 2 diabetes. D. Code only for diabetic nephropathy. Answer, B. Code for type 2 diabetes first, then diabetic nephropathy. This question focuses on the ICD-10-CM guideline for coding diabetes mellitus with manifestations. The key is type 2 diabetes has diabetic nephropathy. When diabetes is associated with a manifestation, a condition caused by the diabetes, the ICD-10-CM guideline requires coding the diabetes first, followed by the code for the manifestation. Many codes for diabetes in the E10, E13 categories are combination codes that include the manifestation, or the index will direct you to code both. Always follow the instructional notes in the tabular list for diabetes codes. Question 24. Patient presents with fever, cough, and shortness of breath. Physician diagnoses pneumonia. What is the main term to look up in the ICD-10-CM alphabetic index? A. Fever. B. Cough. C. Pneumonia. D. Shortness of breath. Answer, C. Pneumonia. The concept tested is finding the correct main term in the ICD-10-CM alphabetic index. Keywords like diagnoses pneumonia tell you the confirmed condition, which is the main term you should look for. The index is organized by condition, not symptoms, so you'd go directly to pneumonia to find the correct code range. Looking up symptoms like fever or cough would lead you to codes for just those symptoms, not the underlying diagnosis. Remember, always code the documented diagnosis when available, not just the symptoms. Question 25. Which element of medical decision-making, MDM, refers to the complexity of diagnosis and management options? A. Number and complexity of problems addressed. B. Amount and/or complexity of data to be reviewed and analyzed. C. Risk of complications and/or morbidity or mortality of patient management. D. Time spent with the patient. Answer, A. Number and complexity of problems addressed. This question assesses your understanding of the three key components of medical decision-making, MDM, in E/M coding. The phrase complexity of diagnosis and management options directly aligns with the number and complexity of problems addressed element. This element considers how many problems are being managed and how difficult they are to diagnose or treat, including whether management options are straightforward or complex. The other options relate to data review and risk, which are separate MDM components. Focus on the problems being managed when evaluating this element.